And then I would look to the speech. The speech flow is speak fluently. There is no slowness in the speech, and he's alert, awake, oriented to place, time, and fully awake. Okay. Did you eat? Okay. How's your breakfast? How's your appetite?
Not so well.
It's not so well. Okay. All right. After that, after I have all of these questions, do you have any cough?
Yes.
Okay. Can you describe the cough for me? When is? Can you describe it? Is it productive or non-productive?
It's productive.
It's productive. How often do you cough?
Every day.
Every day. How many times every day? Like
Continuously throughout the day.
throughout the day.
Mm-hmm.
So you told me it's productive.
Mm-hmm.
Okay. Can you describe the cough? The secretion? The sputum? Is it? What's the color of the sputum?
It's clear, but it has like white dots in it.
White. It's clear and it has white. Is it thick or thin?
Thick.
It's thick. So the cough is productive, thick, and white color on it. Do you have any pain on your cough?
Yeah.
You have some pain on cough? Oh, she has lots of problems. Okay, all right. Okay, and after that, I have my pin light. What I want to do now, I want to check your eye pupils. You put the light off. Oh my God. Okay, and then I will check the eye pupil and to the left side. Can you put the light on? Okay, eye pupils are equally round, reactive to light and accommodation. And can you open your mouth? And I want to check your mouth. I might use a tongue depressor on it, right? And then there is no lesions or anything in the mouth. Can you swallow for me? Do you have any difficulty in swallowing? Okay, he's not having any difficulty in swallowing. After that, I will check for the skin integrity. The skin is elastic skin turgor. Okay, so I've checked that skin turgor. What I wanted to do now, I want to listen to your heart, lung, and bowel sounds. Before I go that, I'm wearing the gloves. I would check the tubings. If there is any IVs, because it's not there, I'm not a visual person. So if there is any IV, I would check the IVs. He's taking IV fluids of sodium chloride, and the IV is patent, and there is no occlusion, and the lines are patent, and the IV line is patent. The transparent dressing, the insertion site, no signs of phlebitis or infiltration. And I could see the date of the insertion of the IV. It was inserted yesterday. Okay, so that one. And then I would look for the drainage, for the location of the drainage, for the color of the drainage, and the dressing surrounding the drainage. So if there is nothing in there, I should be fine. Okay, after that, if I check those drainages and all of these things, what I would do with the gloves? Change it and get another gloves. So I would change and get my gloves, and then I would listen to your heart sounds. Is that okay? All right. For how long I would listen to the heart sounds?
1 minute.
For 1 minute. Can you watch me a whole minute?
Okay. We're not counting, we're just hearing.
We count. Okay.
Time.
The heart rate is 45 to 50. You remember if we decrease it, and it's regular and it's strong, which is +2. Okay. What I want to do now, I want to listen to your lung sounds. If you don't mind, when I ask you to take a deep breath from your mouth, just take a deep breath. Okay. Can you take a deep breath for me? Okay, can you take a deep breath for me? Okay, if the patient cannot sit down, what I can do, like this guy, I can just make it as a 45 degree or so. If tolerate. If cannot tolerate, it's okay. I can do it while he is sleeping. Take a deep breath from your mouth. Take a deep breath from your mouth. Okay. And immediately I will go to the back. Can you sit down for me? Okay. How many points I would do?
6.
It's 6 points. Okay. And the same point, I put it in one side, I have to compare it with the other side with the same spine. Does that make sense?
Yes.
And then I would notice for the chest raise and the symmetry. I don't need to do the chest symmetry in the patient. Just when I'm looking to that, if he's okay, I could see there is a symmetrical chest movement in his neck. There is no difficulty, she has some cuff. Okay. After that, because I'm using the same stethoscope, do you mind if I can listen to the bowel sound? Oh, the lung sounds are clear, no adventitious sounds, and yeah, I could not hear any adventitious sound. And then from the right lower quadrant, clockwise. Okay. Bowel sounds are present in all 4 quadrants and active. What, if you don't mind, I'm gonna just do some palpation to see if you have any pain or any tenderness. Do you have any pain or any tenderness? Okay, the abdomen is soft, no pain or tenderness noted. Patient, and the abdomen is soft. Okay, now, can you squeeze me? Okay, let me check the pulses first. I will check the pulse. For how long I'm checking the pulse? Just to make sure that there's present pulse or no pulse.
15.
Okay, so I would compare it with the same thing.
10.
Pulse is present and strong +2. So again, we count the rate already there, and it's regular. Capillary refill. Capillary refill, it's a brisk capillary refill, no less than 3 seconds. Okay, can you grasp my hands? Okay, he grasped my hands and there's 2 pushes to that. Can you raise your arms? Raise your arms. Okay, can you do it? All right, and then press against my hands. Okay, so, okay, and then she pressed, and the strong power is present in upper extremities. Full strength power in in upper extremities. Now, what is the?
Oh, the
sensation?
The sensation.
When we check their radial pulse, we don't check.
Edema, presence of edema, there is no edema present, right? So there is no edema present. Okay, what I want to check for you now is the sensation, which is the soft and the sharp. This is the sharp and this is soft, okay? And can you close your eyes for me?
Sharp.
Can you see it?
Sharp. Sharp.
Sharp, okay.
Soft. Sharp.
Okay, so I would check the sensation. And
You
you
asked
remember
for
the acronym
reply.
that I mentioned to you? SPECS, right? Sensation, pulse, edema, capillary refill, and strength. So I'm done with that in the upper extremities. I would go to the lower extremities, the same thing. I would do with the pulses. Dorsalis pedis, it's present, and it's +2 and regular. Present +2 and regular. Strength, which is which is +2. That's the strength of it. Okay. Now, can you flex your legs? Okay. He flex his legs. Can you push against my hand as strong as you can? Ouch, he's strong. Can you push your legs? Push as much as you can. Okay, that's strong extremities. So I checked his pulses, I checked his strength. Let me check the sensation. Can you close your eyes? I want to do the same what I did with your upper extremities. This is sharp and this is soft. Okay. All right. So what's that? Sharp. Can someone tell me?
Sharp. Soft.
Yes.
Soft.
And I would do the same with
Sharp. Sharp.
So what if they say it wrong? What do you want to say if they do it wrong?
okay. I want to make sure that I applied adequate pressure on his legs. I might do in this area in the front of the foot. If he's still saying it wrong, then there's something wrong in his sensation. So I would verbalize it as an abnormal finding. Okay, if he could not verbalize that. All right, and then I would check the capillary refill. Capillary refill is less than 3 seconds. There is no edema noted. Did I mention anything about that? Specs, did I cover 5 of them?
Mm-hmm.
Okay, so specs, sensation, pulse, edema, capillary refill, and
Straight.
okay. What else? Actually, this one has to be up. Can you just put that one up? Whenever you move from one area to another, make sure it is lowered down. But if I want to move to the other side, what I would do with this?
Raise it.
Raise it and leave the other one. Okay. Now, what I want your help, if you can go to the other side. Yeah, and then I would wash my hands and document my findings. How long it takes me?
11.
15. I got
17
16
because I'm
minutes.
explaining and take you more than 10 minutes really.
10?
Yes.
Oh my gosh. So our time limit